with those people, have more intentional conversations with the discharge planners, with the social workers, and be part of that larger care planning process. I think, our IP should be part of that larger care planning process and discussion. And the social workers, discharge planners, they need to know what's going on from an IP perspective so that they can properly do their jobs as well.
Infection stops where information starts. Welcome to the Transmission Control Podcast, where knowledge is your strongest defense. Broadcasting from the front lines of healthcare, we dive into the strategies, science, and stories shaping infection prevention today. Each episode, we connect you with experts on real-world insights to help you stop the spread of healthcare-associated infections, protect patients, and strengthen your practices as an infection prevention and public health expert. When the right information reaches the right people, lives are saved.
Hello and welcome to the Transmission Control Podcast. Today we're joined by public health expert Allie Piatkowski to talk about how we take victories from short-term solution to long-term sustainable culture. We'll be right back after a brief word from our sponsors.
Brought to you from the studios of Healthcare HQ, let's get into it. This is Transmission Control.
Hello and welcome to the Transmission Control Podcast. My name is Garrett Hollenbeek, Editor-in-Chief of Transmission Control, and I'm joined today by my co-host, Jill Holdsworth. Jill, how are you today?
Hey, Garrett. I am doing great. Happy to be here.
Yeah, and this one is kind of, for our season finale, we're doing something a little bit different. We've talked to everybody from IP managers to EVS experts, and today we're bringing in a friend from the public health arena. So today we're talking with Allie Piatkowski, founder and CEO of Piat Public Health. Allie, how are you?
I'm doing well, thanks. How are you?
We are good. And this is kind of cool because you're on the main podcast, but we met you from a video segment we did a little over a year ago. Called Ounces Over Pounds, I think, right? And just talking about what you were seeing out there in the public health arena. So now you've founded a new public health consultation group. Tell us a little bit about that.
Yeah, absolutely. And thank you so much for having me back on the podcast. It's a pleasure. Really enjoyed that experience. So yes, last year I founded Piat Public Health. So it is a consultancy that's focused on helping organizations better engage with communities and the people who they're serving, make sense of complex data, and then use that data to drive improvements in the simplest terms. So it's very exciting and excited to share that with everyone.
Allie, that seems like a kind of a scary thing to do too, just to come up with something like that and just dive right in. What kind of prompted you to say, I think this is what I'm going to do. I think this is what the world needs.
Yeah, absolutely. Well, first of all, I really enjoy consulting. I did have several years of consulting experience before for another consulting company called Moxley Public Health. So that allowed me to get my feet wet in consulting. It really works well for me because I have so many different interests and I like working on a variety of different projects with different people and different organizations across the system. And it allows me to bring together my background in public health and epidemiology with my love of community engagement, project management, and strategy into a career that I both really enjoy and that allows me to make an impact on community health. And what it really came down to is wanting to do work that aligned with my values. I often see a lot of decisions being made about communities and, about what should be done about community health issues without the people who are actually most affected by those. And that didn't sit right with me. And then also seeing data that sits around and never gets used, and plans with the best intention never get implemented. So it was really that gap in those things not happening that I wanted to address through the work that I do.
Do you have an example you can give us of one of those things that you saw not happening that really just kind of lit your fire to get started on your own?
Yes, I don't know that it was one particular example. I think it was just a series of those things happening over time. But to get a bit more specific, a lot of decisions within our healthcare system are really oriented around money and resources, and not necessarily what's going to be most effective or impactful for the people who they're serving. So that's something that's really important to me. So either that engagement with people doesn't happen in the first place, or if it does, we collect data by engaging with communities and asking them, what do you think are the biggest issues and what do you think should be done to address them? And we hear that from people, but then that doesn't actually always go anywhere. And that's actually worse than honestly not engaging people in the first place, because we lead them to think something's going to be done about what they have to say. But it's very misleading and really unethical if nothing actually comes from that engagement.
What would be an example specifically of what, or it can be vague, not specific data, but what's an example of one of those decisions that might be made for money that you think that the community needs to weigh in on?
Mm-hmm. Yeah, that's a great question. I think there's a lot around. I'm in Canada, so our government talks a lot about what we call hallway medicine, and people receiving care in the hallways, unfortunately, because beds are overcrowded and there are issues with the capacity in the healthcare system and staffing shortages. And, that was an issue before COVID, and it just became amplified by COVID. And it's certainly an issue, but we don't always look at what's actually the root cause of people being in hallways. Yes, like there are bed and staffing issues, but how could we actually address that more proactively and understand why people are coming to the hospital in the first place? And it's not always because they necessarily need to be there. Maybe they don't have anywhere else to go. Maybe they're experiencing homelessness and they don't have anywhere else to receive services. And honestly, maybe they're happier being able to be in a bed in a hospital rather than being on the street, or seniors who don't have social support or family support at home, and they're not really able to live independently, but they don't really need to be in the hospital either. And there's a lack of kind of an in-between place for people, or that home care support that they really need. So when you ask those questions and actually understand the root causes of those issues, it can lead you to different answers and possible solutions.
That's really interesting. I know hallway beds are definitely something that the U.S. deals with as well, especially in the emergency rooms. Hallway beds are almost like permanent beds these days. And it did, again, become a lot worse during COVID. So that's interesting that you're using your business or your services to try and address the overcrowding of EDs per se, because that's one of the biggest issues in healthcare right now.
Mm-hmm.
Yeah. And one that it sounds like in order to make a change there, a lot of data gets collected, a lot of interventions get planned and put in place. And I imagine you become a pretty quick expert on the change management side of that.
Mm-hmm. Yeah, absolutely. It's not just about finding out what the problem is and how to solve it, but how do you actually solve it in practice and understand the reality of what it looks like to implement a solution.
So do you help with that as well? You help identify, collect the data, and then do you also help with the action planning and solutions?
Yes. So I like to. Ideally, I don't always. The work that I do is very tailored to what the particular client and organization needs. So sometimes it might just be on the assessment side of things, but my favorite projects that I get to work on are really helping organizations go from insight all the way to being able to make that impact. So collect the data and understand the need, but then do something about it and collaborate with their partners to understand how a particular issue could be addressed. So, often I do what we call community health assessments or community health needs assessments. So, ideally we're doing something with that data, and an organization can't do it alone. They need to come together with partners in the community. Let's say mental health is an issue that they found through their assessment that they want to prioritize. Let's say I'm working with a hospital. They really can't address that by themselves. They need to come together with their public health partners and nonprofit organizations in the community, mental health and addictions, the education system, private sector partners to really be able to have a holistic approach that truly addresses that issue.
I think that's one of the huge values of public health experts like yourself, because in the acute care setting or even in long-term care, we're seeing that patient snapshot, but we're not always aware of everything else that's going on in that community that's affecting the data or the patient type that we see or the patient outcomes that we see. I think about that senior living piece that you talked about, and we may see, all right, we're having a big influx of Candida auris. We talked to a guest earlier this season about their point prevalence study and how they kind of identified C. auris cases. And a big piece of that is long-term care facilities. So zooming out from that, I think every IP wishes they could have kind of that holistic approach that you have to say, this is what's happening in my community. This is how it's affecting my hospital.
And honestly, I do wish that more IPs had the type of outlook that you're describing here. And I don't know if it's a lack of time or, a lack of leadership support, but everybody has to be so laser focused on those HAIs that are for CMS and reimbursement. But if we really focus more on the community and improving the overall health of the community and the engagement, then the return would be a healthier community, less infections, would be a return on investment. But it's another one of those that's really hard to show, just like preventing infections in the hospital is hard to show.
Definitely. Yeah, I think it's perfectly understandable that people don't have time to think about these larger issues, and they're often just responding to crises as they happen and not being able to be as proactive as they want to be.
Absolutely. And we've talked this whole season about victory laps and the victories IPs are seeing, public health professionals are seeing. So it's been a challenging landscape. I think anybody who's working in healthcare right now sees that the way things were pre-COVID is different than they were post-COVID. And the way things were 3 years ago is different than they are now. And everything's changing very rapidly. So what are some of the challenges, or I'll say maybe more optimistically, what are some of the victories you're seeing out there in the public health field?
Yeah, I think that COVID really forced us to move beyond doing things the way that we've always done them, moving beyond the status quo and realize what's not working and that we have to try something different, get more creative, get more flexible. And I do think that has continued since COVID. I do think there has been some regression, unfortunately, in some ways, with COVID not being seen as an emergency anymore, that in some ways we can go back to doing things the way that we've always done them a little bit. I do think
in some case worse practices than probably existed pre-COVID.
But I do think overall there has been a shift to doing things differently and sustaining, some of the learnings and the creativity that we saw during COVID. I also think there is more openness to collaboration, both across sectors, within the healthcare system, within organizations themselves, and specifically for myself, fairly recently launching my consulting company, I've seen a lot of desire for collaboration across consultants. Unfortunately, sometimes we can see each other as competition if we're trying to do the same type of work, but I feel that for the very most part, most people want to collaborate with each other and support each other, and we can do a lot more together than we can do by ourselves. So that's a really positive approach that I've seen.
Absolutely.
What are you seeing right now as the biggest need in terms of like a gap between community health and and what's happening in the hospital, do you see something that we could do better as IPs that are inside the healthcare organization? Because you kind of have a view of the whole 360 of healthcare and community.
Mm-hmm. Yeah, I think just more intentional collaboration between the hospital and the community is as simple as it sounds, both from an infection control and an overall perspective. I think often we work very much in silos, like this is the community's job, this is what happens in the hospital, but it's the same people being seen in the community and the hospital. And if we treated it more as transitions between different organizations and care that people receive in different settings across the system, and how can we actually work together across organizations and really as more of a team to care for people, I think that'd be very helpful. And there are examples of that happening, of course, and there are more community-oriented people who work in the hospital and discharge planners, for example, who help people who've been admitted to the hospital get the resources and supports that they need before they're discharged home. I think the more that happens, the better.
So it sounds like infection prevention probably needs to explore some of their own internal partnerships as well, because if you're looking at the discharge planners being kind of that frontline voice, then IP may need to reach out to discharge planners or social workers, or sometimes hospitals have community event planners or marketing, because I'm thinking, as like a hospital IP, I don't know that I would know how to get more involved in the community from an infection prevention standpoint. So just thinking about that, do you have any insights or tips to the hospital IP that says we really need to get involved in our community, but I really have no idea where to start?
I think that's a great point. It doesn't need to be completely outside of the organization. And I agree. I think there are a lot of challenges with IPs within a hospital setting being able to get more involved in the community. But I think, like you said, people like discharge planners and people from different professional backgrounds, I think, often have more view into the community themselves. So I think if you can collaborate with those people, have more intentional conversations with the discharge planners, with the social workers, and be part of that larger care planning process, I think our IP should be part of that larger care planning process and discussion. And the social workers, discharge planners, they need to know what's going on from an IP perspective so that they can properly do their jobs as well.
Yeah, there are so many issues that we see in IP that relate to the community. Think about water quality management. Antimicrobial stewardship is a big one. If a patient gets discharged and they are 10 miles away from their local pharmacy and no transportation, those are going to be issues that affect their ability to, take the medication they need, get over this infection, and not have to go in for a second round because they were 2 weeks late in getting their prescription to get a ride. And those are all things that we're kind of a little bit noseblind to in infection prevention, but having that zoomed out view, somebody can kind of connect the dots to all those pieces.
Mm-hmm. Absolutely. Those are really good issues to bring up, and I think that not many people think about.
Now, when you look at your role in public health, I think one of the maybe stigmas or when IP, I think, at least for me, thinks about public health, we're thinking of our local health department. Mm-hmm. And there's a mixed relationship there. Sometimes they're phenomenal and they're very helpful. And sometimes it's like, oh, I don't want to tell them everything because I'm worried I'm going to get in trouble. So how do you see that stigma changing, or what can we do to kind of have better collaboration, as you mentioned, between infection prevention and public health?
Great point. Well, first of all, I would say infection prevention really is a part of public health. So I think a big part of it is just changing the conversation to redefine what public health is. Yes, it's very much your local public health department, but it's so many other things. And we're supposed to be all about prevention and being proactive in public health. So I think IPs need to be a part of that conversation. And I think the more you can understand that you are part of public health as well, it's not this separate thing. You should be collaborating together, just understanding what public health is. I think that's really helpful. And I think also more education on, what health departments does, the services that they provide and that they don't provide. And, they provide their own IP services as well. So understanding kind of the parallels that are in acute care organizations and in public health organizations like the local health department, what they're doing for IP in the community, and that really you're doing a lot of the same things, just in different settings. I think just having more of that understanding of each other's roles would be helpful.
I think that's a really great point. If anybody's listening to this right now that's from a local health department, for them to realize that a lot of IPs think, oh no, I can't call them for advice because then they might show up at my doorstep and audit us or do a survey or show up and think that they can help us. I've heard that too. Like, would you like us to come on site and help you assess the situation? Well, no, not really. We don't want to voluntarily have the health department come on site and do a survey. So I think that that's definitely a stigma of the health department. So anyone that's listening, kind of doing what Allie said and say, this is what we're doing in the community. This is what we're doing for infection prevention. We're friends, not foe, and we can all work together.
Yeah. I think one of those big barriers breaking down, and it's becoming more common, but it comes up, I think, on most of our episodes, is getting more MPHs and people with a public health background into infection prevention and vice versa. Some of the strongest advocates for infection prevention are people with a public health background who are looking at things a little bit differently than we might from exclusively an acute care kind of framework.
Absolutely. Actually, someone that I mentor, and I don't know how common this is becoming, but she's doing her Master of Public Health right now, and she's actually specializing in infection prevention and control. So I think it's really interesting that some MPH programs actually have that as a specialization and bridging the two. So I think that would be really interesting to see that happen more often.
And I think that's so unique for the MPH candidate who might be going into an IP field, that they have specialized training on IP. There's no other group right now that we know of. There might be in the future that can say that I've had specialized training. I have an MPH, but with especially in IP. I mean, that's really cool. So I really hope that also if you're a hiring manager listening to this, that you're opening up those jobs to make sure that there's not just an RN, not just an MPH, but to all backgrounds, because you may be missing a fantastic candidate if you're not opening up to all backgrounds and degrees.
Now, Allie, I want to pick your brain a little bit on the change management piece, because anytime we have a victory, one of the challenges is how do we sustain that through new staff, new years, new administration? And so what is some of your advice for maintaining a victory once you get to the place you want to be?
I think, first of all, it's important to recognize that the victories have happened in the first place, and, not just be looking at those large tangible wins that are really obvious, but also recognize those smaller, more day-to-day victories and having systems in place for people to share those. It could be on a really informal basis, recognize what your colleagues are doing, share what you're doing, great things that you've seen work and that you hope others will try as well. So I think the first step is recognizing them and then also having a plan in place to carry those forward. So it's not just, okay, it's great that this victory happened, but how can we make a plan to actually make that easier to happen in the future, share it with people, create roles for people to actually act on that victory. Like, I'll just make up an example. Maybe from an IP perspective, maybe it's something to do with hand washing, and you're able to find a really low barrier intervention to, get more hand washing uptake, and who's going to be responsible for carrying that forward in the future. Is there going to be a lead who's really going to champion that initiative and share that with people? How are we going to remind people that this is a best practice that we want to enact? How often are we going to check in on what's going on and how well that new initiative is going? What kind of indicators do we want to track in terms of how many people are participating in this initiative? What kind of impact it's having? So both from like a process and an impact perspective, really kind of quality improvement and evaluation. It doesn't have to be fancy or super formal. I think it can be done on a more informal basis too, because I think sometimes we can also get a little bit heavy-handed, and that's a lot of work for people to do on top of what they're already doing. So it can be really simple tracking processes as well.
Those are really great tangible things that any healthcare organization can do, is just having a champion for something. Let's say we have a change and it's positive and it's working well. And then we go and we look at that a year later. What are the common reasons you see that doesn't get sustained over a long period of time?
Mm-hmm. Yeah, I think time is the biggest thing. People have their core operational work that they need to do. They're very busy. They are often doing often they feel like extra initiatives on top of what they're already doing off the side of their desks. And it feels like extra work. It's not as important. And I think going back to having that champion, often there's not a particular champion identified. And we just say it's everyone's job to do this, but there's no one who's actually taking charge on that and really being the vocal champion. So I think those are the biggest things.
That's a really great example too, because usually we have these change champions that are like, then they get every new task and every new, hey, we want you to monitor hand hygiene and PPE and room turnover to make sure that it's done right. And it's like these same 4 people that are just the champions for everything. And then they get burnt out, where it's the IP that gets burnt out. And then that intervention totally goes away. All the wins kind of go down the drain a little bit.
And those tend to be the same people who are on all the committees too, the CLABSI committee, the audit committee. But it's also hard to find people who actually want to be part of these things and aren't just voluntold. You don't want those people either, because then they're not engaged. So you don't really know what is best, to have a new face or to have somebody that actually wants to be there.
Mm-hmm. That's very true. It does tend to be a lot of the same people, because those are the same people who are most engaged, but they can't do everything. So I think the more it can become part of people's regular day-to-day and operations, and not seen as something that's just a QI project and something that's completely separate, and at an organizational level, building in QI time for people, into their day-to-days, ideally. It's, easier said than done. It's not always possible, but being able to give them like a certain amount of QI time per week or per month that they can actually focus on these initiatives. They don't feel like they're taking time away from their other work.
QI time. That's an excellent idea. And I think that's something that gets overlooked. Yeah. How do we make it part of culture that this is what we do at our organization or in our community? Now, you had mentioned the amount of data that you collect when you're working with an organization or a system. And sometimes I think it feels like we collect a lot of data at the beginning, and then that either gets shelved or that never gets shared with staff outside of the one meeting that we had. So what are some of your advice for keeping data alive and fresh and making sure that people really get the most value out of it?
So I think from my perspective, I'm often doing initiatives like community health needs assessments, and that's often where I'm collecting the most data, which is incredibly important, to do that on a regular basis and especially engage with the community. But that can't be the only time that data is collected. It needs to be collected on an ongoing basis, and we need to give the community or give patients and clients ongoing opportunities to be able to provide feedback and share their voices, so that it is something that's more sustainable and it's not just a check the box exercise. Yeah. So things like having, patient, client, community committees, organizations, or representatives of, people being served, receiving services, people with different types of lived experience, that people can provide their feedback on a more ongoing basis is really important. Online forums for people to provide feedback, meetings or forums that they can come to, just having a variety of different ways for people to provide feedback. And it's not just, okay, you're going to participate in a survey every 5 years. having people know the different ways they can provide feedback and having different channels for them to do that. And then really making sure that you're sharing data on an ongoing basis back with them. Yes, through things like a community health needs assessment report, but also having, ongoing places where they can see data, dashboards and websites and things like that, and making them as accessible as possible to the everyday person who doesn't necessarily have a healthcare background, making sure that that data is understandable and useful to as many people as possible.
Thank you for sharing that. I think that's such an important call out to keep the data visible and present and have somebody be able to go back to a dashboard or a website and say, this is how we're trending and what I'm doing, really matters. So as we close out this excellent conversation, what is one piece of advice you'd give to IPs working to keep their momentum alive for the victories they saw this year?
I think it goes back to paying attention to what's working. So those wins, even if they're small, and really to build on those, celebrate that progress that you've had, share what's going well with people, and to try to build on that progress and to amplify it. Because if we don't know what you're doing or what's going well, it can be really easy to focus on the negatives and the challenges, which are absolutely important to discuss and reflect on and figure out how we can address them, but to also focus on those strengths and what's going well, and to enact some of those change management practices to be able to advance those changes. And just to remember that often prevention work can be very much forgotten, unfortunately, because it's all about making sure that things don't happen, and we don't always know when they don't happen. So just remembering that your work matters even when it's invisible.
I love that. Thank you so much, Allie, for sharing, really bridging that gap and connecting the need for collaboration between public health, infection prevention, and for sharing your expertise. We appreciate you being on the podcast today. Thank you.
You're very welcome. Thank you both for the great conversation.
Allie had so many great tips and insights on how we can better partner with the community and within our own healthcare organizations, which I really loved, because as an IP, it's something that you always think you need to do, or we need to do a little bit better, but we don't really think about how it can really impact the greater good of healthcare and the well-being of our community and our patients. So I thought this was a really cool conversation.
It really was. And one of the things I wrote down is building in that QI time. In Allie's role in public health, she's dealing with a lot of change management, a lot of heavy lifts for a lot of people. And so having an expert come in and say, you need to build in time for these quality improvement projects to take root and become culture. So I think something we overlook, but would be transformational to keeping those victory laps going. So we're grateful to Allie and to all of our audience for season 3 of the Transmission Control podcast. So stay tuned for season 4 of the Transmission Control podcast. That's going to be coming out in March. So make sure to like, follow, and subscribe to the Transmission Control podcast, because infection stops where information starts.
Thanks for tuning in to the Transmission Control Podcast, where infection stops because information starts. If you enjoyed this episode, let us know. Connect with us on LinkedIn, Facebook, or wherever you get your podcasts. Don't forget to leave a 5-star rating and share this episode with your team. Until next time, stay informed, stay vigilant, and keep transmission under control.